Good evening and welcome once again. Today is our 1477th day of continuous webinar. Neha ji, can you please stop the slide sharing?
No. This is the news.
Okay. Ashutosh,
Slides
Dr.
for your
Ashutosh.
session.
Okay. Okay, thank you, sir. Thank you, sir. I didn't notice. Okay, thank you. And today is our guest, Ashutosh Bhardwaj, and his BHMS and postgraduate diploma in medical law and ethics, and working as a registrar in the State Council of Homeopathy, Himachal Pradesh. I am welcoming Dr. Ashutosh to IFPH. Doctor, you're welcome. Please.
Dr. Ashutosh, unmute yourself, sir. Dr. Ashutosh, please unmute yourself.
Yeah.
You are muted, sir.
Yeah.
Now,
Yes,
Unmute.
yes.
Yeah. Now you are okay, sir.
Okay. Thank you, sir. I would like to first of all thank Dr. Sani for giving me this opportunity of sharing my views about a topic which is not a clinical topic, but very important for the doctors. And especially as a regulator, this is our endeavor to sensitize doctors about various legal aspects of their practice. So my topic would be understanding professional conduct and etiquette and code of ethics for homeopathic practitioners.
Yes, you can continue, sir. It's visible and you are audible also.
So first, I would like to share that what we understand by ethics. So there are a few terms like morals, ethics, and law. As we see this in this Venn diagram, these are all interrelated somewhere. What are our morals? They become our ethics, and ethics become law. What is the moral values? What are morals? So morals are basically the inherent goodness, badness, or something which we are born with, or which we are taught by our mothers, friends, families, and culture, right? And then when the morals they are woven into some, a group. The way we treat our morals in a group, as a professional group or as a community, as a society, then they become ethics. And ethics are something which are from morals and ethics are both are from internal force that we implement. And when something external force implement those ethics and morals, that becomes law. So just as this slide shows that what are ethics is the body of moral principles or values governing or distinctive of a particular cultural group. These are they are the professional behavior, and morality is just the right or wrong behavior that which we are taught. Something which can be which is morally good cannot be may not be ethically right, and which are both ethically and morally right may be at odds with the law. For example, in Afghanistan, as per law, the treatment the women met in Afghanistan, that was okay with as per the law was there, but morally that could be wrong, right? So morality is that it is a personal behavior that is being taught. Everyone knows what is good and what is bad, right? And when as a professional body, we devise certain we devise on a bigger platform those morals, and then they become ethics of that particular group or that particular profession. Every profession has their ethics, be it architects, engineers, teachers, lawyers, doctors. Even it is said that even thieves have their ethics, right? And the thing is, when we don't follow our ethics, when we don't go by our moral values, and we deviate from our moral values, and we don't, and we decide about in a community, and we even we don't follow those ethics, then comes the force of the state, right? And it makes it a law, and that for that we are punished. That is an external force, which governs in our behavior. So it is a better that we should follow our morality well. And if we have some issues with morality, then we should go by what our community, what doctors have decided, what group of engineers, what group of lawyers have decided. We should follow those ethics. Otherwise, the laws will come on us, right? We have in India, it is said that we have law for everything. Recently, this like last session I shared that even for handwriting, if the court has to give direction to the doctors to write in a legible handwriting, that shows that we do not follow our ethics. It is clearly written in the ethics that every doctor has to write his prescription legibly. But there were some instances. Recently there was a judgment from Odisha High Court which directed the MCI to issue directions again to write prescription in the capital words. There are plenty of jokes about doctors and writings that a doctor's wife goes to the chemist to read what the letter doctor has written. She cannot even read the letter, and sometimes even doctors cannot read what they have written. There are many examples that law has come. Every law comes when we do not go by what we had decided collectively as per our ethics that we'll do this, right? So what are the basic principles of medical ethics? Basically, there are 4 pillars of medical ethics. They are autonomy, non-maleficence, beneficence, and justice. And we'll explain what these are. Autonomy is the right of a competent adult patient to take decisions regarding his or her health care. There was a time that when people would say that whatever doctor is next to God, and whatever doctor says is fine, you decide about us. But now, not now. Patients are well informed, and it is the duty of the doctor to educate the patient, to just navigate him to arrive at a right decision for his treatment, that whether he should go in for surgery, whether we should go in for conservative treatment, whether we should go in for some other method of any treatment. We do not have to paternalize that we know the best, and this is what we are saying, you should go for this. No. And even that autonomy has been enforced by various different judgments of the courts, that the patient was not well informed, educated, and well informed in his own language, in his own way of understanding, that the level of understanding has to be of the patient, not of the doctor, right? And patient should also have a right to refuse treatment if we have to, for the reasons to be recorded, that this patient, I advised him this treatment, but the patient is not willing to go in for that treatment. That has to be recorded as per in your medical record. And then you cannot force somebody to go in for a medical research. We cannot make anybody guinea pig of any research project. And doctors should provide relevant information, but should not influence the decision of the patient. That is autonomy. And this principle of autonomy further develops into right of informed consent, which is a very important thing. Non-maleficence, we all know, we are being taught, we basically also on a moral plane, we should do no harm to anybody, and especially when we are in a position that we can actually do harm. And how do doctors do harm? Not by doing something they are supposed to do, or by doing something which they are not supposed to do. That is both by act of omission and by act of commission. Sometimes we have to take a decision. We do not take that decision, right? Patient is going downhill, and as per our ethics, that is the time when we should refer him to a higher center. We should advise him to go in for a surgery or consult some specialist or super specialist, and we do not do that. That is an act of omission. We omitted our action. That is also harming the patient. And sometimes we do something which we are not supposed to do. So that is also an act of harm to the patient. So this principle, if we do not follow, that is a malpractice. That is a medical malpractice. आपके पास patient had come to you. You knew that he needed emergency surgery. The abdomen was to be opened, and then you do not do that. That is a medical malpractice and is misconduct, and that can lead you to legal suit. And then next is that is the corollary of non-maleficence is beneficence, that we have to do good to the patient in under any circumstances. We have to do good. Do good. Goal of the treatment should be for the benefit of the patient. And whenever the treatment is to be decided, and every treatment has a effect and side effect, benefit and harm. So when the benefit outweighs the harm, that treatment is to be provided. That is also another third pillar. And next is justice. All patients should be treated fairly. No discrimination based upon the gender, age, religion, caste, class, or nationality. That is the principle of equality. That everyone who comes to our practice, who seeks medical help from us, is to be treated. We cannot deny somebody that he belongs to this caste. I don't treat this. That I don't see this. I don't see this class of patient. I see only rich people. That patient of equality has to be there. Then clinical needs of the patients sometimes, but we have to discriminate, not in that sense, but equity. There are 2 or 3 patients and the resources are limited. Then doctor has to decide that which patient gets the resources first, right? A patient with simple headache or patient who is suspected of MI, he needs your care before the patient with the headache. So that the principle of equity is also to be taken care of. Then these are the principles. Now the National Commission of Homeopathy has a board of ethics and registration for homeopathy, and they made the regulations based on these principles only. I was one of the members of the expert group who helped frame these guidelines. They were also there before also at the time of Central Council of Homeopathy, but since there's certain new legal aspects and new some like social media and telemedicine had come, so some guidelines had to be incorporated into that. So these guidelines are effective, these regulations are effective since December 2022. So what are the values in medical ethics? So component of medical ethics is that there are different levels of relationships between a doctor and a patient, right? A doctor and a physician and a physician. How do they interact with them? And relationship of the physician to the system, to the healthcare system, and relationship of the physician to the society. These are the 4 different, segments that these ethics are to be divided. How the patient has to treat his patient, how the physicians themselves have to interact, and how physician interacts in the healthcare system of in which he's working, and what are his responsibilities towards that healthcare system and towards the society. So next is a character of the homeopathic physician. Naturally, a doctor has
Doctor,
been.
can you
Yep.
enlarge the slide? I mean, in the maybe sorry. It's because of my it's it's big only. Okay.
Yeah.
Okay.
So
Which slide you are playing now? Number of slide?
That's the character of homeopathic practitioner and the standard of character and morals and
But
responsibility.
I'm seeing, I think this is the first slide, understanding the professional conduct and ethic and code of ethics. It's not moving.
For all?
That may be for all. Any of the participants, can you please say which slide you are saying? Yeah, it is for everyone.
Okay, I
Actually,
think
the size is I minimized. But please click on slide is not moving. Yeah, message came from the participants. Dr. Ram Parvesha.
just hold on, please.
Doctor, do one thing. Please stop the
Yeah.
slide share and then again share the screen again. Then again you can try.
Can you see it now?
No, no. Have you shared it? Now
Yeah.
not share the screen from the beginning. Share the screen, then.
I just did.
Yeah. Now it is started. Yeah. Now we are seeing the 11th slide. I think up to 11 you have played already. Yeah.
Yeah.
Yeah. Now it is ethics and behavior. Yeah. Law, morals, ethics. Yeah. It's this.
Sorry for that. Sorry for that mix-up. I think I mean, because there was not much to be seen here, and what I told was the crux of the matter.
It's okay. It's okay. From wherever you stopped, you can continue from
Yeah,
that.
well, yes, we'll go with this character of the homeopathic practitioner, that he has to
Okay.
render services to the humanity,
Okay.
and
Okay.
right, he has to be diligent in caring for the sick,
Okay.
and he has to be modest, sober, patient, and pious. Uh, Modest, I mean, he doesn't have to be very. He should not over. He should not boast about his achievements. He should not show off in the society as well. These are the things that he has to do in the society, and he has to be sober and dress accordingly in his behavior, in his demeanor, right? We cannot expect, I mean, just imagine going to a temple or a church or a mosque, and waiting for a priest to come, and he comes in bermudas wearing, I mean, tattoos and all, and I think nobody will digest that. So similarly we have to dress accordingly, we have to I mean, look accordingly, we have to be sober, and it is expected of a doctor to be patient and pious. Is not religiously pious, but in his thoughts and his behavior he has to be pious. So he has to conduct himself with propriety and without anxiety, without his I mean, internal anxiety showing on to the patient, and making him more nervous. And he has to have a highest level of character and morals. And a man of character should not have any, I mean, interactions with the patients which are not required professionally. And he has to be temperate in all the matters, should not lose his cool, he should not be, I mean, violent in his behavior, should uphold the dignity and honor of the profession, and service, not monetary gain, should be the primary objective. That is a bit expected from the doctor, that his primary objective should be service. Monetary gains can come in on the way. And responsibilities of the I mean, practitioners of homeopathy are that they should merit the confidence of the patient, and especially this is for the homeopaths, because we're not relying on the merely investigations of the patient, just like the other systems do, that they can prescribe medicine going by the reports only. We have to I mean, extract symptoms and everything from the patient, so that is only possible when we win the confidence of the patient. And he's not only responsible for the patient, but as a society as a whole. He should continuously improve his knowledge and skill, and should share that benefit of improvement with his patients. Like NCH is now coming out soon with the guidelines to make it compulsory for the doctors to attend some seminars or to have continuing medical education. These guidelines are in a draft stage and might go to the I mean, next level, when we will have to have, for our renewal of registration, to attend some certain fixed number of seminars or continuing medical education programs. That is a very welcome step on the part of National Commission of Homeopathy. And next we'll come. I mean, that was the thing, that morally we are supposed to behave in a certain manner, right? To give authenticated document, not do fraud and not fudge records. But maybe some of us did not follow those, and then that came into ethics. We are, as per law now, we are required to give. That is a problem with, especially our system of medicine, that doctors do not give any prescription. They give codes, and rather some people do not even give single written statement. But now it is now made it was earlier also, but now it is again made mandatory that you have to share the prescription of the patient on request within 74, not later than 72 hours. Otherwise, he can sue you in the court that doctor is not sharing his prescription, right? And then we have to take care of our medical records also. Issue medical certificate when desired on the prescribed format. We'll share it later, the format of the medical certificate, and keep these records for the 3 years. That is a legal requirement now. If you do not have that record, somebody goes to the court and you cannot produce, you are, you are held liable to be, you are to be held responsible for the misconduct. And every clinic, every prescription, every medical certificate should have your registration number on clearly written on it. And your registration should be updated. Now the regulations have come that if you do not update your registration within 6 months, you lose your right to practice. And even those in the government job, they might lose their jobs if they do not renew their registration within 6 years, and it is 6 months. And if the non-renewal of registration, if it exceeds 2 years, that registration is deemed to be cancelled, and that particular physician, that particular practitioner has to re-register himself, following all the formalities from the very scratch. And next is he may use doctor as a prefix to his name, who only those persons whose medical qualifications are recognized by National Commission of Homeopathy, or earlier CCH. And now you may ask that why was we understand that we can write doctor, but there were many cases where people challenged you that aap doctor nahi likh sakte. You cannot write doctor in front of your name. Only MBBS doctors can write, right? So this is now has been given legal teeth. And what are the parts of medical record? A majority of our homeopaths are in private sector, right? And in the government sector, it is mandatory. There are different reports to be sent. So record keeping is a compulsory aspect. But private practitioners, they do not take the keeping of the record very seriously. But they should now, with the patients' education and patients' awareness level increasing, and matters becoming medico-legal in a matter of time, only the medical records can save you from whatever you have done. You may have done something which were not beneficial for the patient, but if you have recorded it in your record, courts are lenient in that way. But if you have not written a single thing in your record, nobody can save you. So the part of records are your OPD records. All of these records have to be, patient comes to you today, you have to keep that record for 3 years. Any prescription given, any investigation suggested, any referrals given, everything has to be recorded and kept for 3 years, maybe in physical form or in electronic form, whatever way you are keeping your healthcare records of the patients. And in case you run an IPD facility, every patient prescription slip, every diagnostic record, every referral, every consent form, and even progress report. You cannot just do that. Patient is doing well. Patient is doing well. Patient is no. You have to record his blood pressure, whether he's going up or down, whether he's improving or whether he's not improving. And your medical certificate are your part of medical record. They are to be kept. A counterfoil is to be kept. Medical certificate is to be given to the patient, countersigned by the patient, and then counterfoil is to be kept for 3 years. It can be asked along with that your OPD record. If you have suggested rest for a patient, for example, you have suggested rest for 1 week on given certificate to the patient, that 1 week has to be recorded in your register also. Right? All the medical reports or dying declarations, and in case you have informed the police, those all are the medical records. Court may ask that whether did you inform the police? Did you, when you, for example, a case of a roadside accident comes to your clinic, maybe you cannot manage that, but even if you have given him first aid, refer to him higher center, have a record of that. That the patient came, he was talking, he was walking, he was alive at that time, and whenever he was brought to my clinic. But as per my limitations, I just gave him first aid and I referred him to the higher center. That is to be recorded, and that may become a part of medical legal proceedings. Right? Medical record keeping and documentation. Good medical record keeping is extremely critical to the delivery of good quality medical care. If you have not written your record, you don't have record, you cannot follow up those patients later on. And there are, basic principles of good record are they have to be, a record has to be correct, no fudging of the records, right? It has to be clear, it has to be comprehensive, and it has to be chronological. The patient comes to you at 2 p.m., what you did at 2 p.m., and what happened at 3 p.m., what happened at 4 p.m., what happened at next day. It has to be chronological. It cannot be just messed up. And good record are your, again, I'm emphasizing that good records are your best defense against allegations of negligence and or medical practice. I might take some session on different medical legal cases that we have. And there are, when I was studying this PGDMLE, I came across there are many, I mean, landmark judgments which involved homeopathic doctors. And those things did not concern only the homeopaths, but general medical practitioners. There are very old cases. For example, for the start of vaccination, there was a case of Kerala homeopath when the Supreme Court decided that it was mandatory to have vaccinations. So it is not that that the medical cases are for the hospitals, bigger hospitals. No. Recently, there was a case in after COVID from Calcutta High Court where the doctor did not, a homeopathic doctor did not order timely investigations, and the case was of a respiratory illness, and the patient died. And the court held that doctor responsible, that this homeopathic doctor did not make use of the modern investigative techniques which were available to him. So these things are to be taken care of because people are now dragging homeopathic doctors also to the court. Then what is a medical certificate? How is to be written? It has to be written legibly, in clear handwriting. Preferably, we should write in capital letters, right? And on the certificate is to be on the doctor's letterhead. It cannot be just on a plain paper. It has to be on doctor's letterhead, and as earlier I mentioned, it has to have your registration number on it. It should not contain abbreviations. Clearly full. You cannot write for bronchial asthma. You cannot write BA. It has to be diagnosed because when you give medical certificate, you have to have a proper definitive diagnosis. A simple backache you cannot just advise rest for a simple lighting backache and advise. No, you have to have a diagnosis. You arrive at a diagnosis and then it can be tentative. It can be, not final diagnosis, but it has to be diagnosis and it has to be clear. Certificate should only be issued in case of an illness, and certificate should indicate the date on which the examination took place and the degree of incapacity of the patient, whether to what extent he should be taking rest, he should be taking strict bed rest, or how much movement you just allow the patient. Indicate the doctor on which the doctor thinks that the patient will become all right, tentative time, and it has to be prospective. Backdated, it cannot be, you cannot issue backdated. It's a patient came to you and he asked that for last 1 week I was not well, please issue me a certificate. No, you should not, and you cannot do that. And name, signature, qualification, registration number of the RMP are to be there on the certificate. Nature and probable duration of the illness has to be, and it must be countersigned by the patient. And next is the burning topic is these days is the advertisement. As per these new regulations, you cannot advertise directly or indirectly in newspaper, placards, or handbills about your practice. about your, what are you doing. Use of name, photograph, signature in lay channels to invite attention for advertisement, for self-benefit. You cannot do that. Advertisement through price list, publicity material, or traders or manufacturer, or letter of thanks from the patient cases in the lay papers. Many a times, when patients write to you, I became all right, and you can give it in the medical journal. You can, you can put it on some conference, but not in newspapers or in lay journals. And you cannot write in some, storybooks that, some magazines like India Today, that you cannot write that this patient said that I became all right after your treatment. Although you can use it in some conference or some scientific journal. Objectionable claims can. This is a bane today. Many of doctors and many of them homeopaths making objectionable claims on e-platforms. Now, Supreme Court has invited attention of Ayush authorities. Even I am being part of drug regulatory system. We are these days monitoring different social media platforms, and I've come across a number of homeopathic doctors, and we have started reporting them, that making claims about unnecessary claims about the cases. 53 diseases are there in the Drug and Magic Magic Remedies Act, for which we cannot claim. We cannot make claims. There are 53 illnesses. And then to some extent, the advertisements are allowed, that you cannot, for example, if you change your place of practice, you are going on leave, you're coming back after certain, taking a sabbatical, and then you can do that. And certain e-platforms like Practo or other things, where doctors they can advertise them, where only patients visit. Right, write up in the media about the hygiene lectures, TV, without suggesting your treatment. You cannot. You can write an article about allergic bronchitis, for example, allergic rhinitis, and but you cannot suggest treatment, that these are the medicines that you should take. Or in the footnote, you write that this, I am Dr. Ashutosh Bhardwaj and my clinic is this. That is not allowed. That becomes a misconduct. And there are many ABDBM, Ayushman Bharat Digital Mission. Under this program, all the healthcare professionals have to register. You have to register your health facilities. Registration system is going on these days. You can register, that is allowed. Now these are the professional services. There we have to give a prior intimation to the patient of the fees to be charged. You have to display your fees in your chamber, in your waiting hall. Patient has to know that this is the fees that the doctor is going to charge. It is to be displayed, and fees can be reduced on your discretion. Right, and poverty is one of the grounds that you can charge less from the patient and choose not to charge. But once you have, for example, you have displayed that you are going to charge 500 rupees for a consultation, and after seeing the patient you cannot charge 600. You can also charge 400. Right, and no cure, no payment sort of agreements, they are unethical. They should not be done. And duties of homeopathic practitioner to the patients. There are certain obligations to the sick. He is to be treated first. You cannot refuse any treatment, any help to the patient. Once he is in your clinic, you have to attend to him. Yes, if you have your limitations, your limitations of your knowledge, limitations of your appropriate place, until that time the patient reaches that particular place, you are basically thought to be in charge of that patient. Right, patient is not to be neglected, and acts of negligence, any act not done in good faith is a negligence. Sometimes, it is not that all the patients become all right, all the patients get cured, or the patients, but the action that you took or not, you did not take, should be in good faith. And using medicines which are not prepared according to homeopathic principles is an act of negligence. not using investigation techniques where required. This is the case that the Calcutta High Court I was talking about, not using investigation techniques when required. You have to require, maybe we do not require investigations for final selection of the medicine, but to then I mean I there are not and I don't think that I have to impress upon the importance of diagnostics for a homeopath. These diagnostics are important for prognosis of the case and for different aspects of the cases. Not using investigation technique is also a misconduct when required. Not acting according to minimum standard of care expected. There are different cases in the courts where people, when go to the court, it is the court takes into consideration that what a group of, practitioners was expected, not the best of that minimum standard of the care. What was expected of those doctor, expected of that doctor, that is to be taken, not that what a specialist or super specialist would do in that case, right? And what is the duties to the patient? They have to, a doctor, a medical practitioner has to act according to laws of homeopathy and it to help in maintaining of public health. Just like, recently all of us had this COVID, the COVID experience that how we had to follow, how have we had to obey all the public health laws, all the public health guidelines, all the instructions issued by the government. He should follow all the laws of statute notified by the central government, state government, or local body governments. All the laws like Biomedical Waste, Drug and Cosmetic Act, MTP Act, POSCO Act, everything. Every doctor has to know about those laws and what he's supposed to do. For example, HIV, HIV Act, we have to know that we are not supposed to disclose this diagnosis of HIV to anybody except when required by law, or certain situations are there in that act when we can disclose. That is basically, as per law, that is not to be disclosed even to the partner of that patient, right? Behavior, how our behavior has to be towards the patient. We have to be sympathetic, kind, compassionate, and caring, and revealing the prognosis of the case. We should not overemphasize, right? We should not, make the patient nervous about telling him about his prognosis, his or prognosis, and we should not underestimate also about the prognosis. The two facts of the case have to be, and most important is ethics of privacy, confidentiality of the medical record. Ethics of privacy, you just cannot go on revealing what the patient has told unless required by the law. Nobody can force you to share the details of the patient. You should not share the details of the personal details of the patient, whatever he has confided in you, unless required by the law. Court can always force us to reveal. And duties of the homeopathic practitioner of the profession. We have to uphold the dignity and honor of the profession, membership of the medical society. Again, even our constitution stresses about the importance of fraternity. So we should all have this brotherhood relationship among us, and we should take the memberships of the societies so that we enrich those societies with our knowledge, with our experience, and in turn get enriched by the knowledge and experience of the other members of that particular society. And another is exposing the unethical conduct of any member of our profession. That is also our ethical duty and moral duty, that we should report that, although that is not being done, but we should report. Associating with unregistered person and indulging in malpractice. Anybody, for example, doing illegal MTPs and all, and we are associating, we are giving our services to that particular nursing home or hospital, that is also a misconduct. And appointment of substitutes. For example, if we are going on a holiday, we are taking a break for some time, or for some other personal reason, we are going for 10 days. Even in private practice, we should have ethically, we should hand over some of those patients to some of our substitute who will give. And substitute has to be adequately qualified, not and that we gave it to some unqualified person, any pharmacist or chemist, just that in case of an emergency you can consult him. The appointment of substitute has to be, I mean, of the minimum standard. Now, services without fees to the fellow practitioners. It is also expected, though not legally, I mean, enforceable, but it is expected that we should treat our our professional colleagues, we should not charge them, especially the professional colleagues and medical students. So emergency visit, once it is being requested, you are I mean, morally and ethically bound to attend that emergency. Yes, for I mean, going by the limitations or your knowledge or your experience or expertise, you can always refer that particular, but you cannot refuse an emergency. Engagement in obstetrics case, again, you cannot just abandon that patient whom you have taken into your care. Duties of the practitioners of the homeopathy in consultation. Consultation is to be encouraged. That is a bane of our profession, that we do not encourage consultation. We do not. We think that we know the best. That attitude has to be removed, and that has to be discouraged. And patient referred to another practitioner of homeopathy, and it is the duty of the practitioner to whom it is being referred to refer back that patient with his written opinion. That teleconsultation by telemedicine, these ethics, there are guidelines by the Ayush Ministry for Ayush practitioners about telecommunication, telemedicine. Simply writing medicines on the WhatsApp is not legally, I mean, correct. It can always be challenged. As far as things go right, nobody complains. The moment things go wrong, you are dragged to the court. And consent is to be taken by medical treatment. Although for our part of treatment, there were no surgical procedures are involved. Patient visiting, the consent is more of implied consent. Patient has come to your clinic, that is deemed to be his consent. But in case you go in for some other investigations or for some other procedure, informed consent is must. And duties of the homeopathic practitioners to the public. Practitioner as a citizen, public, I mean, he has to behave properly as a citizen. Just like I told you about his behavior, demeanor, dress, and everything, and he has to follow all the laws. It is supposed that I mean, you follow even the traffic laws. It is not that that it gives you certain immunity from that. You are a doctor, you cannot fall. You you need to jump red lights, right? As a practice, as a citizen, you have to be a law-abiding citizen, and for public health, you have to follow all the I mean, guidelines. For example, these days, National Tuberculosis Elimination Program, when private practitioners should be aware where to refer those patients and when to get sputum tests done. And you have to be aware about the notifiable, non-notifiable diseases. I mean, now we have become wiser after COVID. So, and about dispensing of the medicines, as per the Drug and Cosmetic Act, uh, a practitioner can dispense medicines from his clinic, but he cannot run an open clinic shop, chemist shop. You cannot sell medicine. You cannot sell medicines from your clinic. Only you can dispense. Dispense means whatever you have written, you can give it to the patient. Not somebody, you are not supposed to honor somebody else's prescription. That becomes a open chemist shop, right? And what are these were the what was expected of you, and what is, I mean, what counts as a misconduct. Not following these regulations is a misconduct, and conviction by court of law in moral turpitude. In any rape case, I mean, violence, murder, I mean, then that is a misconduct. Action can be taken against you. Adultery, misbehavior, improper association with the patient, untrue, improper medical misleading certificate. That's a very serious issue. Giving wrong certificates, giving improper, untrue certificates to the patients, and acts in contravention of Drug and Cosmetic Act. So basically, you have to be legally aware about. I mean, lack of knowledge of law is no defense in the court. You cannot just say that I did not know that it was a law. That is no defense in the court. So another is affixing signboards in chemist shops or places where you do not work. You can have You cannot have your signboard 4 kilometers from your practice. It has to be in your clinic area only. Disclosure of confidential information except that prescribed under the law. And that is the issue of certificates of experience to unqualified or non-medical persons. You should not issue that this person is qualified to practice this and this is under my training for so many times, such and such time. You should not give those certificates. And you should not engage touts or agents for procuring patients. Claims to be the specialist without possessing special. There are many on social media, n number of doctors to be homeopaths who are cardiac homeopaths, renal specialist, kidney specialist, nephrologist homeopaths. Those qualifications, only those convicted for offenses arising from the abuse of alcohol, which is regarding the professional misconduct. Right? You should not drink and go to your clinic. And practices any other system of medicine other than homeopathy, provided nothing in this clause shall prevent or restrict the practitioner under national health program. For example, certain people who are engaged in a government job, they are required by the government after certain training to give DOTS treatment, tuberculosis treatment, or something like that. That is allowed. But anybody else practicing any other system of medicine is a misconduct. So this list is not exhaustive. Basically, anything can be added to that with the, as any thing is to be treated as a misconduct, that can be added into that. Prescription and dispensing are maintenance of medical record as per the general clinical practice guidelines prescribed by CCRH. We should go to CCRH website and find out what those GCP guidelines are. According to that only you have to keep medical record. And he shall prescribe after proper clinical assessment and diagnosis only, and shall follow various provisions of Drug and Cosmetic Act 1940. Procedure for attending complaints. Any complaint, State Medical Council or BRS shall take action suo moto on complaint within 6 months of the complete. There are the punishments to be the different punishments to be prescribed are by the state board. And states have prescribed, and any action can be taken. His license to practice can be suspended, can be on hold for some time, or it can be cancelled. Even there are provisions where, if a person who's not a homeopath and pretending to be homeopath, they 6 months imprisonment or 2 lakhs of fines is there. So in case there's a pro forma to be reported about the misconduct, state board has to take action, and in case state board takes action and the practitioner wants to appeal, he can appeal within 3 months to the Board of Ethics and Registration. After being found guilty, action is to be taken. So under Section 34 of the National Commission of Homeopathy Act, these are the punishments of the Central Act. State acts, all different states have their own. You should go in on the websites of your state councils and read about those acts and act accordingly. So these are the list of the certificates which a homeopathic doctor can issue. The certificates of birth or death, certificates of leniency, education acts, public health acts, medical driving licenses. There are 10 different types of certificates. Certificate in connection with the pension matters. All these informations are available on the National Commission of Homeopathy website and the websites of your respective state councils. It is not, nobody can say that you cannot give this. Only this medical, mental lunacy act only the homeopath who has an MD degree in psychiatry. Right? Rest of the things as per your qualification, as per not mind it should not be untrue. Otherwise, strict legal action, simple, your license can be revoked. This is the, basic template of the medical certificate, which has been released by the National Commission of Homeopathy. It is available on the website along with the fitness certificate. Next is about the registration regulations. We have to, since many of the persons attending are already registered, you have to renew a registration next, according to new guidelines, after every 5 years. There cannot be lifetime registration. Whichever state has done that, that is to be now revoked. Every state has to devise their acts accordingly, so that after every 5 years you have to renew your registration. And as I told, if within 6 months of the expiry of the registration you do not renew your registration, that is, you are illegally practicing homeopathy. And if after 2 years you do not renew your registration is deemed to be cancelled, and you have to apply afresh. Follow all the things that you did for the first time, and paying all the fees and all that. And every practitioner has to, after completing his or her degree, register in the state of his domicile. You cannot register in many states. Your first registration is in your domicile state, and in case you go to another state to practice, you simply have to enroll yourself into that state. Informing that particular state council that I am practicing in this state. For example, somebody practicing in registered in Chandigarh, if he wants to practice in neighboring state of Punjab, Mohali, he has to inform the Punjab State Council that he or she is to practice in Mohali, and there's a form available. You have to apply on that form, and enrollment register is to be maintained by the state governments. You can enroll in different states also, but permanent registration is in the state of your domicile, right? Then license is to be updated every 5 years, as I told you. Registration regulation, removal and restoration of the name in case of you give forged documents, your name can be removed from the state register, and state council may remove after giving opportunity to be heard in person. Right? Registered homeopathic practitioner can appeal to the BERH against the removal of his name within a specified period of time. This is the enrollment form. That when you get transferred, even a government employee who is registered in a particular state and he gets transferred to another state, he will have to enroll himself in that particular state also on this form. That adjunct register has to be maintained by all the state councils. That is something new. Earlier, doctors used to take NOC from that state, get his name struck off from that state, and apply to the other state. That is not required now. You have to keep your registration in the original in your state of domicile, and you can practice in any other state without getting your name struck off from the original state. Right? Thank you very much. Now that's all I have for today.
Thank you so much, Doctor. We have 5 minutes. If anyone have questions regarding this topic, you can ask to Dr. Ashutosh. Actually, this is the area we are not aware about. I think some of the points while you are saying something, I was remembering the days we have studied jurisprudence and
Yes.
some of.
For example, we have to be, well informed. For example, many of doctors do not know what the POSCO Act is, right? For
Yeah.
example, 18-year-old girl or 17-year-old girl comes to your clinic with complaining of amenorrhea. You cannot simply give a medicine to her for that. You have to investigate whether, in case she might be pregnant, and in case she turns out to be pregnant, you are supposed to inform the police. In case you do not, you are dragged to the court.
Even when you are saying about don't give any medicine through WhatsApp, likewise many points,
Yes.
neglected points, it's there. Anyway, Dr. Manoj has raised hand. Can you stop the slide sharing so we can see each other? Dr. Manoj. you can ask now, please. Yeah.
As Dr. Agini mentioned, it's an important session and everybody should be aware of this. And I have some suggestions regarding the advertisement. Because the only, I think the homeopathy system is the Lord system of medicine who are very strict regarding this management of the advertisements. The allopathy hospitals, they are giving a lot of advertisements. The newspapers, the pharmacies giving a lot of advertisements. And the Ayurveda, but nobody is controlling them. But we, necessarily or unnecessarily, very much bother about these advertisements. Then another thing is that the recognition of foreign degree. I think the National Homeopathy Commission as well as the medical board should do something regarding to give acceptance to our BHMS abroad. That's the most important thing. Recently, I think the Medical Council of India had tried that way, and they got permission to the MBBS course in certain parts of the world. So that's the two suggestions I would like to. And then another important thing is that we don't have the drug controller who is controlling all these things. Only the allopathic physician, they are not at all aware of homeopathic medication, often giving judgment regarding the drug controlling. So all these things is to be considered as a chairman of the medical council, I think. Thank you.
Thank you.
Yes, you have raised three topics. First is advertisement. These regulations are almost a copy of what the MCI has and what the central CCIM has.
Yes.
These are not, we just cannot say that this is overemphasized for the doctors. But the private hospitals are giving advertisements. They are not following their law.
Yes.
It is also there in their regulations also, right? And
but
certain
taking-
aspects of advertisements are allowed.
Yes.
Right. Next is foreign degrees. Foreign degrees, that's a matter of, to be taken call was to be taken by NCH, right? And the third was
I know
about
that
the drug regulations.
Yes.
Yes. Third, that is not that factually that is not correct. That there is no regulation. I myself am a drug inspector. I'm a drug controller for state of Himachal Pradesh, and I'm a member of formulation committee of Himachal Pradesh. There is a licensing authority in Himachal Pradesh. There is a licensing authority. There is a Ayush vertical in CDCSO. There are homeopathic drug controllers in CDCSO. Right? We have Dr. Rachna Paliwal from, she is a homeopathic doctor who is an assistant drug controller in the CDCSO. And the homeopathic drug regulation now is becoming very robust, right? The formulations and sanction of formulations and GMP regulations, they are very strictly being followed now. They were already in the law, but the implementation was not there. It has already started. So the laws are more strict for homeopathy. It's not so, right?
I think in Kerala, there is no such a provision for this drug control and homeopathy. In Kerala, it is not there, I think.
and one more thing, I think there is no homeopathic doctors, those who have studied this kind of postgraduate diploma in medical law and ethics, and we are I think how you thought about to study this PGD.
I was a member of Central Council of Homeopathy with Dr. Sani sir from 2015 to 2020.
After that, you studied this?
No. Then I was co-opted when it became a national commission. I was co-opted as an expert member for this drafting these regulations. And I was also working as a drug inspector in the state. Then I thought that without knowing the law, you cannot devise law and you cannot implement law.
Yeah.
So I came across a course in the National Law University of Bangalore about this the PGDMLE course, and I joined that. And
many
after
of us
that,
have to study this also.
yes. I mean that is why I'm stressing upon the importance, because most of our practice is in the private sector.
Yeah.
Right. And I'm working in the government sector. Some laws and legal formalities are taught to us, forced on us. But what I see is my private colleagues, they're not very much aware. And there was a time that nobody bothered about homeopathic practitioners making mistakes, but it's all right, koi baat nahi theek hua to koi baat nahi. But not now. Now people demand response. You cannot just even. I think that very soon giving of a placebo is going to be an issue with the homeopaths without written consent, because there is a placebo ethics also. WHO has devised ethics of placebo, and sooner or later our our bodies, our system has to incorporate that. You just cannot give a patient placebo for 2 months after giving one dose without him knowing that he's been given placebo. Suppose something goes wrong and he comes to know that doctor was prescribing placebo, and I was taking it as a medicine.
I'm so sorry to say, because we have to start our Malayalam session
Okay, fine.
next. So we need more discussion about this topic, and every college should college students, when they are passing out, they should have idea about this kind of courses that helps the law and ethics. Thank you so much for coming. Come again, and we will
Thank you very
discuss
much.
again this topic. Now I am inviting Dr. Manoj for moderating Malayalam session. Dr. Manoj, please welcome. Thank you so much, Dr. Ashutosh.
Thank you very much. It was my pleasure.
And thank you everyone for joining with us. And now we are moving to Malayalam session. Thank you.